Hey everybody, welcome back to my channel. So for those who don't know, I'm Leisha Nicole, and I usually do videos on like VA benefits and other things related to VA, 100% total and permanent. You can check out my other videos which are on my channel. So today I'm going to talk about something a little different. I am still going to give my full disclaimer. I don't know if you guys can see me. Hold on, let me turn it this way. Here we go. I'm going to still give my full disclaimer. I'm sitting in my closet because I was in here messing around. And I kind of just thought about this video talking about my recent experience with a VA hospital in South Carolina. And I'm a veteran. My mother is also a veteran. And she is 72 years old now. So my disclaimer, again, I do not work for the Department of Veterans Affairs. My only affiliation is as a veteran, and that is it. So this is our experience. So before the pandemic, I brought my mom to Delaware. I wanted her to be seen at the hospital up north in Philadelphia. I live in Delaware, but Philadelphia is the next biggest hospital. So she was seen there, and they did a procedure. My mom was diagnosed with cancer maybe about 11 years ago, and she beat the cancer. She had uvular and esophagus cancer. She was in North Carolina at the time, so she was at Raleigh-Durham, which the doctors that dealt with her were from Duke. Phenomenal. They took excellent care of my mom. So fast forwarding, she did not quit smoking like she should have. And she got another spot. She had a spot on her lung. Now the one thing, and like I told my mom, which when she came down the first time, they saw her at the clinics in Delaware, and they referred her to, I think they have a tumor clinic. It was like a tumor board that they talked about, and they kind of figured out, well, she's like 70 years old, so we need to not put her through a lot of stress. A surgery would put her through a whole lot of stress. So they all came up, and I'm gonna tell you something. Philadelphia VA, I don't care what nobody say, they are phenomenal. They did an excellent job of taking care of my mom. So they saw her, and they came up with a way to freeze the spot. Same day surgery type procedure, went in. I think they froze it several times, but they wouldn't know if it worked until, I want to say he said maybe 60 to 90 days after. Not for sure. But after she got it done, she stayed here for, I don't know, a month or two, but then she wanted to go back home, so she went back to South Carolina. So anytime you dealing with VA, you can only be seen at one VA hospital at a time. Like, she couldn't be registered and active here and in South Carolina. So when she went back to South Carolina, my sister was taking her back and forth to the doctor. So now this was my thought, and I mentioned this to my sister, and I don't know, I think the doctors in South Carolina just did not listen. What I said was, hey, she's gonna, and the doctor that performed it even stressed it. Please make sure that they do a biopsy to check to make sure. Did they do that? They did not. So my mother is 71 at the time of this surgery, and the doctor that did the surgery, he was geeked up that he could do it. And I'm only going off of what my sister said, because I personally didn't talk to that doctor. He could do it, and I'm thinking, is he looking? My mom is all of 110 pounds soaking wet. So her first surgery, her first cancer experience, they pulled all of her teeth. She lost a whole bunch of weight. So this is a lot. So now this time, I'm thinking they're going to check to see if this spot was still cancerous. You see my facial expression? They did not. They did not check to see if this spot was still cancerous. They just did the surgery. During this pandemic, you know, you can't have visitors. So my mom goes into a hospital. She's 71. She don't have no family around her. So for the first 2 weeks or so, we didn't even talk to her. I had to go through the patient advocate, because I felt like, if you know we can't come into that hospital, why is it that you guys aren't calling us to say, hey, this is what your mom is doing, she's okay, blah, blah, blah. We had to keep calling and harassing the nurse, waiting for nurses' calls back on that fucking boat. So it was just a lot. Okay, so come to find out, the doctor, when we do talk to him, he goes, well, you know, the lung, he never said that my mom's lung collapsed. He said, you know, well, the lung we're trying to get it to heal faster. So what they had to do is transfer her to a non-VA hospital. What? Well, they have specialized, okay, so I'm like, okay, they got specialized doctors that's going to help my mom. This doctor still never mentioned all of the side effects of this surgery, which he should have mentioned it to my sister before they did the surgery. So now they do this surgery. She gets 2 weeks after the surgery, she gets transferred to a non-VA hospital, which I was able to go in. So the minute she was being transferred, that next day I drove down south so that I could be there every fucking day, because it was so stressful not talking to her. She had tubes everywhere. It was a lot. So now she's there, they up the suction, they getting it so that the lung, now mind you, I don't believe her lung function is ever been the same since. She loses her breath quickly from the bathroom. It could be 5 steps, it seems like she's losing her breath. So this is a side effect. And she's already older. She's not really eating now. She lost her appetite when she was in the hospital because they gave her a feeding tube. It was just a lot. So fast forward now, after this fiasco of fuckery, I bring her back. I bring her back to Delaware because I want the doctors here to see her. So the pulmonary doctor called me, hey, I see your mom is in the system. This guy is phenomenal. He called, hey, I see your mom is in the system, blah, blah, blah. He proceeds to have the discussion with me that, well, did you know that the pathology report showed that there was no cancer in that spot that the doctor removed? Y'all see my face, right? I said, wait, what? Nobody told us that. Nobody said nothing to me. Nobody said nothing to my sister. So we're like, I was like, are you fucking kidding me? What? So you're telling me, wow. I'm still speechless, because not only did this surgery take a whole lot out of her, she is not ever going to be the same again. She might be 100 pounds. She may eat once in a blue moon. She has a feeding tube in, so now that is her 3 to 4 meals a day. Formula through a feeding tube. And then to come to find out, the piece of shit that did the surgery, if you had checked, because I specified that Philadelphia froze the cancer, didn't know if it was going to work or not. It was a chance that it wasn't, and it was a chance that it was. So obviously it worked. But now, this woman ain't never going to be the same again. She don't have no energy. She don't want to eat. She just doesn't want to do anything now. So now my mom is completely different than she was before the surgery. I'm going to tell you like this. Family members dealing with your elderly parents, dealing with VA, you have to be there for them. See, South Carolina don't want family members in the hospital because of the pandemic, and I do understand that. However, if I said, she has a slight touch of dementia, I don't want her in that hospital having conversations, because she's not going to remember. So there are certain things that it is blowing my mind that these guys, and my sister, when she said, I told them, the doctor in Philadelphia wanted to make sure that they do a biopsy. Why didn't you just do the biopsy? Because now my mom's life never going to be the same again. I have to make sure, and she hates, like she had she got the feeding machine. She hates to be hooked up to it. So now I do bolus feeds where I'm using a dropper to feed her an 8-ounce bottle every 3 to 4 hours. Because this is what my mom's life is like now. So I'm going to just say, the VA that she went to in South Carolina, horrible service. Like I said, I had to complain and have a voice conversation with the patient advocate and whoever else was on the phone because the lack of communication. It was a lack of communication before they even did the surgery because he didn't explain to my sister. See, I ask certain types of questions. She asks certain types of questions. So we're not going to ask the same things. So I wish that I would have had the conversation. And I felt extremely bad that I took her back down there. I should have waited till after we got the results here. If it was 3 months, 6 months, whatever. Because then she wouldn't have went through none of that. So yeah, do I feel fucking bad? Absolutely. But as a veteran, I'd be damned. Every veteran needs to know. Certain hospitals ain't going to give you the service. And I know they talk about a lot of VA hospitals. Most of them will say, oh, Philadelphia was on point. They was on point when I'm referred to them. They always do what they're supposed to do. The fucking VA hospitals down south, and not all of them, the one in South Carolina. And I don't know about any of the other ones. Shame on them. Shame on them. And then to top it off, you did a surgery that had mad side effects that you didn't even tell the family, and then had to physically transport her in an ambulance to a regular civilian hospital for them to further the treatment so that she could at least get better and get out of the hospital. Now, she is not ever going to be the same. She is mad weak. She is tired. 5 to 10 steps, she loses her breath. So when y'all out there in South Carolina, pay attention to those VA people, your parents, if you have any veteran parents, or even for yourself. Because I know a lot of retired military people that get VA, they don't even go to VA hospital. A lot of them stick with their TRICARE. But everybody don't have that privilege. And for my mom, I probably should have had her because she is retired. I should have kind of went on the other side and not did the VA. So this is just my story time of a bad experience that is now something that me and my sibling, because it's just me and my sister, are going to have to deal with for the rest of my mom's life. I got to make sure I take care of her. And it was horrible just knowing that you did not even check to see if that spot was cancerous before you went jumping inside of her to remove it. And now she might be 98 pounds. She don't eat. It is devastating. And I hate it. But I can promise you that she won't be seen at that VA again. And if you do see her, because I know she eventually going to have to go home. I know my mom won't want to stay with me forever. Which if she did, I wouldn't mind. But if she do have to be seen there, you won't do a fucking procedure on her ever again. Last year when we did find out what that spot was before Philadelphia did the freezing, quit smoking. I made sure of that. She ain't smoked since. So yeah. Just wanted to kind of get out here and have a conversation. At VA, the worst experience, turned the family's life into something completely different. And yeah, they fucking suck. I promise you. They suck. So I just wanted to quickly have a conversation. I know I rambled, but sometimes you got to have conversations and talk about certain things. And me being a veteran, I became a veteran. My mom was a veteran. My mom is a veteran. I joined the Army because my mom joined the Army. And for the veteran care to be substandard in certain places and excellent in others, it's sad. It's sad. It should be across the boards. Everybody is getting quality fucking service, and that's not the case. Some VA hospitals probably don't give two shits about these veterans, me, or any other veterans. That's so sad. It really is. It's really sad. Hey, this is just me talking about my experience, my mom's experience as a veteran at 2 different hospitals providing similar care. So, this is Leisha Nicole again. Hey, give me any comments below, your experiences, if you had a bad or a shitty experience at any of the VA hospitals, or you just want to shoot me a what's up, do so. Hit that like button if you felt like this was something that gave you some insight on certain things that's going on. So, I'll see you on my next video. Peace out.